The pandemic is taking its toll in numerous ways, from job losses, economic hardship, childcare challenges, to the postponements of weddings and reunions and funerals. But it's also taken a serious toll on our mental health. Opioid overdose deaths are way up. Today, two health officials from Mayo Clinic Health System looked at how COVID-19 has intensified a problem that existed before the pandemic arrived. News 19's Mike Biermeister virtually attended that briefing. Mike, it is a growing problem in La Crosse.
Yes, Scott, as we've reported, overdose deaths have already doubled in La Crosse County from last year. 27 people have died so far in 2020. 16 of those deaths are attributed to the opioid fentanyl, which is a legitimate drug in treating pain. However, more and more people are obtaining it illicitly and mixing it into other drugs. This crisis, much like the pandemic, also does not discriminate.
It is not a respecter of persons. Everyone is vulnerable.
The coronavirus pandemic growing yet another problem, the opioid crisis.
We need to work faster because in 40 states, at least, the rates of overdose deaths are increased during COVID-19 and steadily increasing.
Health experts at Mayo Clinic Health System say economic downturn and isolationism appear to be the main driving force behind more opioid overdose deaths. But Dr. Halena Gazelka added that the shifting of resources toward the pandemic has also helped grow addiction and even death due to backlogs in procedures that often help wean people off of opioids and lead them toward other methods of reducing pain.
We were not having as much contact with our patients, and patients with legitimate pain concerns had a difficult time obtaining their medications.
To help reverse this trend, health experts believe proactive approaches must become priority to help meet people before they end up in the emergency room.
That's everything from education to people who have never had an opioid yet, to providing medically assisted therapy for patients with opioid use disorder.
In La Crosse County, that means improving the overall system, starting with the correct allocation of resources for those working on the front lines.
It's not so much increased staff capacity as it is to how it's coordinated and where it's moved to and taken to help those with substance use disorder and mental health concerns.
Bliss added that funding for resources like computers and plexiglass also need to be there to help professionals follow up with their patients and provide that treatment. One proactive approach that we're seeing take effect this month is the distribution of NARCAN kits by Gunderson's Tri-State Ambulance. The kits contain NARCAN's naloxone, which can reverse the effects of an opioid overdose. The healthcare provider became the first in Wisconsin to have their ambulances carry these life-saving kits that also contain information on how to get help. Scott, during the briefing, both doctors also spoke about the important role of telehealth and how it's become vital for healthcare workers to interact and help their patients. Both Mayo and Gunderson are using this tool to help those patients with chronic pain or those suffering from addiction.
Thanks, Mike. La Crosse has 5 medication-assisted treatment providers who have all increased their capacity to help treat addicts.